Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on connective tissue diseases, SLE, rheumatoid arthritis, scleroderma, each with 4 answer choices and detailed explanations. Connective tissue diseases clinical vignettes. 1. Systemic lupus erythematosus. A 28-year-old woman presents with fatigue, joint pain, and a malar rash that worsens with sun exposure. Laboratory findings show positive ANA, anti-dsDNA, and low complement levels. What is the most likely diagnosis? A. Rheumatoid arthritis. B. Systemic lupus erythematosus. C. Scleroderma. D. Dermatomyositis. Answer: B. Systemic lupus erythematosus, SLE. Explanation: SLE is a systemic autoimmune disorder characterized by malar rash, arthritis, nephritis, and serositis. Anti-dsDNA is highly specific and associated with lupus nephritis. 2. Drug-induced lupus. A 55-year-old man with hypertension is started on hydralazine. 2 months later, he develops arthralgia, fever, and a positive ANA. Which antibody is most specific for this condition? A. Anti-dsDNA, B. Antihistone, C. Anti-Smith, D. Anti-CCP. Answer: B. Antihistone. Explanation: drug-induced lupus caused by hydralazine, INH, procainamide, phenytoin, penicillamine, ethosuximide presents with positive ANA and antihistone antibodies, but spares the kidneys. 3. Lupus nephritis. A 24-year-old woman with SLE presents with edema and foamy urine. A kidney biopsy shows immune complex deposition in the glomeruli. What is the best test to monitor disease progression? A. Anti-dsDNA and complement levels. B. Rheumatoid factor. C. HLA-B27. D. ESR and CRP. Answer: anti-dsDNA and complement levels. Explanation: lupus nephritis is a serious complication of SLE. Low complement C3, C4, and rising anti-dsDNA levels indicate disease activity. HANA 4 rheumatoid arthritis, RA. A 50-year-old woman presents with morning stiffness lasting over 1 hour and bilateral MCP and PIP joint swelling. What is the most specific lab test for diagnosis? A. NEB, rheumatoid factor, anti-CCP, HLA-B27. Answer: C. Explanation: RA is an inflammatory arthritis affecting the MCP and PIP joints but spares DIP. Anti-CCP is more specific than rheumatoid factor. 5. Felty syndrome. A 60-year-old woman with long-standing RA presents with splenomegaly, neutropenia, and recurrent infections. What is the most likely diagnosis? A. Still's disease. B. Felty syndrome. C. Mixed connective tissue disease. D. SLE. Answer: B. Felty syndrome. Explanation: Felty syndrome is a triad of RA, splenomegaly, and neutropenia. It increases the risk of infections. ASH 6, Scleroderma, systemic sclerosis. A 45-year-old woman presents with tight, thickened skin, Raynaud's phenomenon, and GERD. Her serology is positive for anti-Scl70 antibodies. What is the most likely diagnosis? A. Crest syndrome. B. Systemic sclerosis, diffuse. C. Mixed connective tissue disease. D. Sjogren's syndrome. Answer: B. Systemic sclerosis, diffuse. Explanation: diffuse systemic sclerosis affects the skin and internal organs and is associated with anti-Scl70, anti-topoisomerase 1. 7. A 50-year-old woman presents with calcinosis, Raynaud's phenomenon, esophageal dysmotility, sclerodactyly, and telangiectasias. Which antibody is most specific? A. Anti-Scl70, B. Anti-centromere, C. Anti-dsDNA, D. Anti-RNP. Answer: B. Anti-centromere. Explanation: Crest syndrome is a limited form of scleroderma. It is associated with anti-centromere antibodies and carries a better prognosis. 8. Mixed connective tissue disease, ZTD. A 35-year-old woman presents with features of SLE, systemic sclerosis, and polymyositis. Her serology is positive for anti-U1 RNP antibodies. What is the most likely diagnosis? A. SLE, B. Systemic sclerosis, C. Mixed connective tissue disease, D. Dermatomyositis. Answer: C. Mixed connective tissue disease, MCT. Explanation: MCTD presents with overlapping features of SLE, scleroderma, and myositis. It is associated with anti-U1 RNP antibodies. 9. Sjogren's syndrome. A 55-year-old woman presents with dry eyes, dry mouth, and bilateral parotid gland swelling. A biopsy of the salivary gland shows lymphocytic infiltration. What is the best test for diagnosis? A. Anti-Scl70, B. Anti-CCP, C. Anti-Ro-SSA and Anti-La-SSB, D. Anti-dsDNA. Answer: C and Anti-La-SSB. Explanation: Sjögren's syndrome is an autoimmune disorder causing xerostomia and keratoconjunctivitis sicca. It is associated with anti-Ro-SSA and anti-La-SSB. 10. Polymyositis, dermatomyositis. A 40-year-old woman presents with proximal muscle weakness and heliotrope rash over the eyelids. What is the most likely diagnosis? A. Rheumatoid arthritis. B. Scleroderma. C. Polymyositis dermatomyositis. D. Fibromyalgia. Answer: C. Polymyositis dermatomyositis. Explanation: Dermatomyositis presents with proximal muscle weakness, heliotrope rash, and Gottron's papules. It is associated with anti-Jo1 antibodies. Final thoughts. These high-yield vignettes